Stress echocardiography is a valuable tool in assessing cardiac function under stress. While generally safe and widely used, there are important contraindications to consider, ensuring both the safety of the patient and the accuracy of the test. Contraindications are situations where stress echocardiography should be avoided due to potential risks or limited diagnostic value. These contraindications can be classified into absolute and relative categories. Absolute contraindications are those conditions where stress echocardiography should never be performed due to the high risk of serious complications. Key examples include acute myocardial infarction. AMI performing stress echocardiography during a heart attack can exacerbate the condition, leading to life-threatening complications. Unstable angina. Patients with unstable angina are at significant risk of a myocardial infarction during stress, making the test dangerous. Severe aortic stenosis. The heart may not be able to manage the increased workload, potentially resulting in severe complications such as heart failure or sudden cardiac death. Acute aortic dissection. A medical emergency where stress echocardiography could worsen the condition, leading to catastrophic outcomes. Acute pulmonary embolism. Added stress on the heart could worsen right ventricular strain, risking hemodynamic collapse. Severe hypertension. Uncontrolled extremely high blood pressure can lead to hypertensive crises, stroke, or heart attack during the test. Active myocarditis or pericarditis. Stress could aggravate inflammation of the heart muscle or pericardium, causing further cardiac damage. Relative contraindications are conditions where stress echocardiography might still be performed, but with caution and under careful medical supervision. These include severe left ventricular outflow tract obstruction. Conditions like hypertrophic cardiomyopathy can cause significant obstruction that may worsen with stress. Advanced heart failure. Patients with severe heart failure may not tolerate the stress, and the test could exacerbate their symptoms. Recent stroke or transient ischemic attack. TI stress could increase the risk of recurrent stroke or other neurological events. Inability to exercise. If a patient cannot perform the required exercise, pharmacologic stress agents might be used, although this approach has its own risks. Significant cardiac arrhythmias. Certain arrhythmias can worsen with stress, potentially leading to hemodynamic instability. Understanding contraindications in stress echocardiography is essential for several reasons. Patient safety. The primary goal is to avoid harm. By recognizing contraindications, healthcare providers can prevent potential complications in high-risk patients. Accurate diagnosis. Performing the test on a patient with contraindications can lead to dangerous outcomes and inaccurate results, causing misdiagnosis and inappropriate treatment. Appropriate use of resources. Understanding contraindications ensures that stress echocardiography is used effectively, reserving it for those who can truly benefit and avoiding unnecessary risks. Guidance for alternative testing. For patients with contraindications, alternative diagnostic tests or management strategies can be considered, such as non-stress imaging modalities, medical management, or invasive procedures like coronary angiography. In summary, stress echocardiography is an invaluable tool in cardiac diagnostics, but understanding its contraindications is critical to using it safely and effectively. By carefully assessing each patient's condition, clinicians can make informed decisions, minimizing risks and optimizing patient outcomes. The knowledge of when not to perform the test is just as important as knowing when to use it, ensuring that every patient receives the best possible care.